जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैत गदाधर सरस्वती गौर भक्तवृंद। हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे। जय श्री महाराज की जय, जय जय गुरु महाराज की जय। अनंत गुरु वैष्णव भक्त की जय। जय श्री राम। जय सिंह श्रृंसिंह जय 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 नृसिंह उग्रं वीरं महाविष्णुं जगन्तं सर्वतोमुखं नृसिंहं विष्णुं भद्रं मृत्युर्मृत्युर्नमाम्यहं। जय नृसिंह श्रृंसिंह जय 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 नृसिंह उग्रं वीरं महाविष्णुं जगन्तं सर्वतोमुखं नृसिंहं विष्णुं भद्रं मृत्युर्मृत्युर्नमाम्यहं। जय नृसिंह श्रृंसिंह जय 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 नृसिंह उग्रं वीरं महाविष्णुं ज्वलन्तं सर्वतोमुखं नृसिंहं क्षणं भद्रं मृत्युर्नमाम्यहम्। जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैत गदाधर शिवशक्ति गौर भक्तवृंद। जय श्री महाराज की जय। number particular. Hello.
Yes.
Hi, good morning. Uh, Still you're sleeping?
Yes.
Okay, it's okay. I'm little now have to finish. Have to finish. Can you see that now? Can you see the screen? Can see now?
Yes,
Okay.
thank you.
Okay. So we are starting lumbar vertebra. Okay. As like yesterday, you can ask the question rapidly. I will answer.
Okay, 1 second. 1 second. I'm open.
Which lumbar vertebra are these? Which vertebra? The lumbar vertebra. Identify the structure. See the photo. Okay. Good.
Which vertebra is it?
Okay. This is lumbar vertebra.
As the first structure, not of the bonds between joints between two vertebrae.
Zygapophyseal joint and intervertebral joint. Once again, the parts of the vertebra. This is vertebral body and vertebral foramen. Then pedicle, and then this is the lamina, pedicle and lamina. Then spinous process, transverse process, superior articular process, mammillary process. Here also accessory process. Mammillary process, accessory process, vertebral foramen, vertebral body, pedicle, lamina, spine. Okay. In between the two vertebra, we have intervertebral joint and zygapophyseal joint. Intervertebral joint and zygapophyseal joint. Okay.
What type is a disc joint? What type is a disc
These are
joint?
secondary cartilaginous joint.
Movements of lumbar spine.
Lumbar spine have flexion, extension, lateral flexion, axial rotation.
Lateral flexion. Okay. Identify anterior longitudinal ligament.
Here, that picture is not there. Anterior longitudinal will be anterior to vertebral bodies and intervertebral discs.
Posterior longitudinal ligament.
It will be posterior to intervertebral the body and the intervertebral discs.
Ligamentum flavum.
Ligamentum flavum anterior to the lamina, anterior surface of the two lamina and spinous process.
Yes. Okay. How many lumbar vertebrae are there?
Lumbar vertebra 5.
About anatomy of intervertebral disc.
Intervertebral disc has a central nucleus pulposus surrounded by annulus fibrosis.
What happens to the disc with aging?
With aging, there will be degeneration, dehydration, shrunken, uh, and then degeneration and weakening and protrusion.
In posterior herniation of L4, L5 disc, which nerve root is affected?
L4, L5 will be affected, and there will be loss of sensation on the dorsum of the foot and weak hallux extension.
Show the area of sensory deficit for L5.
L5 sensory deficit, dorsum of the foot and anterolateral aspect of the leg.
Is what are the contents of extradural space?
Extradural space, we have network of internal vertebral venous plexus, then small arteries, spinal nerve roots, lymphatics, loose connective tissue, fatty tissue. Network of internal vertebral venous plexus. Uh, Network of internal vertebral venous plexus, small arteries, spinal nerve root, lymphatics, loose connective tissue, fatty tissue.
What are the significance of internal vertebral veins?
These are the connections. These are the connections of the plexus of valvulus veins that drain deep vein that drain organ of the pelvis, such as prostate and rectum. In malignancy or infections in these organs, uh, easy spread to the plexus around the vertebral areas.
Yes. Is spread to the plexus around the vertebral area. Spinal cord ends at which level in adults?
In adult, lumbar 1, lumbar 2,
Children?
lumbar 3.
What is Coda-Equine syndrome?
Coda-Equine syndrome due to compression over the nerve root below the ending of the spinal cord causes some symptoms like saddle paresthesia, low back pain, lower limb weakness and numbness, sexual dysfunction, and bladder and bowel disturbance.
How does it happen?
Due to compression over the nerve root below the end of the spinal cord.
A. What is the space between dura and the ligamentum flavor?
Dura and ligamentum extradural or epidural.
What is the embryological origin of vertebrae?
Vertebra from mesoderm. Vertebra from mesoderm. Vertebra developed from mesoderm. Vertebra
Yes,
developed from mesoderm.
Next, identify the ascending aorta.
Ascending aorta, number 3.
Conus arteriosus.
Conus arteriosus. Conus arteriosus, number 7.
Pulmonary trunk.
Number 9.
Right atrium.
Number 10.
Mention the branches of the ascending aorta.
Ascending aorta, right and left coronary artery.
What are the structures? Number 1.
Number 1, anterior cusp of tricuspid valve.
Number 2.
Number 2, anterior papillary muscle.
Okay. Number 5.
Number 5, anterior papillary muscle.
No, 5.
5 chorda tendini. Sorry. Number 1, anterior cusp of tricuspid valve. Number 2, anterior papillary muscle. Number 5, chorda tendini.
Mention the branches and vertebral level of pulmonary trunk.
Pulmonary trunk branches are right and left pulmonary artery, and vertebral level are lumbar 4, lumbar 5.
Yes. What are the faculties of cortex mean?
They prevent prolapse of the valve leaflets during ventricular contraction.
Mention the structures in the lung phylum. How many?
2 pulmonary artery, 2 pulmonary vein, 1 pulmonary artery, and 1 principal bronchus. 2 pulmonary vein, 1 pulmonary artery, and 2 principal bronchus.
Yeah. The most anterior one?
Pulmonary artery and vein.
Vein. The most anterior one is pulmonary vein.
And most posterior, most anterior pulmonary vein, and most posterior
Bronchus.
branches of the principal bronchus.
What are the bony attachment of the diaphragm and anterior?
Zippered process of the sternum and lower 6 costal cartilages. Posteriorly, first, second, and third lumbar vertebrae and 12 rib.
That which level does IBC pierce at?
IBC pierce at thoracic 8.
Which part of the diaphragm does IBC pierce?
IBC goes through the central tendon of the diaphragm.
Combines with
Right phrenic nerve.
where to auscultate for pulmonary and aortic valve?
Aortic in the right second intercostal space, parasternal edge, and pulmonary left second parasternal edge, uh, left second intercostal space, parasternal edge.
Mm-hmm. Identify 3. Identify 3.
1 second. Okay, where to auscultate? Okay, pulmonary second intercostal space, left parasternal edge, aortic second intercostal space, right parasternal edge. Now identify 3. 3 is ascending aorta.
5.
5 auricle of the right atrium.
11.
11 left ventricle.
12.
12 marginal branch of the right coronary artery. Marginal branch of the right coronary artery.
17.
17 is the pulmonary trunk.
18.
Right atrium.
22.
22 right. Where is 22? Where is 22? I cannot see 22. Ah, here in the middle. Right ventricle.
25.
25. 25 superior vena cava.
Yes. How many cusps in pulmonary 1?
Pulmonary 3. No.
Only tricusp. Aorta 3
Oh, pulmonary valve also 3, I guess. Only bicuspid valve has 2.
Oh, okay. Yes. Only bicuspid.
How many cusps in pulmonary valve?
Yes. Aorta 3. Tricusp 3.
How many cusps in pulmonary valve?
3.
Shit. Yeah, I'm also 3.
Coronary artery.
Coronary artery in this picture.
No. The
Next picture. Identify coronary artery. This is the okay. This is coronary artery.
Okay. Next, identify number 1.
In this picture, identify number 1. These are the branches of the principal bronchus, right and left.
In the previous picture,
Coronary.
which
My question also. Right and left coronary, how we will know? This looks like this is pulmonary trunk and this is arch of ascending aorta, right? So heart in which direction? I think this is the left one. Left one goes posteriorly.
This is branch of right.
yeah, exactly right. Coronary artery, if you want to say, okay. This is the right coronary artery. This one, right coronary artery.
Yeah,
And,
in blue, right.
and
That's a,
this
that's
will be left coronary artery.
wave lift. Show me.
In the picture, I have written. What we will do now, we are getting the idea what are the recent updates of the mocks and this thing. Well, we will go to our file again. This point, suppose when we will open the heart, we will see all the structure and the name.
Uh, identify two.
One second. Here, number one is the branches of the principal bronchus, both right and left. On both side, we have one. Then number two, branches of the pulmonary artery, right and left. Branches of the pulmonary artery, right and left. Number eight is the pulmonary ligament, only the left side. And number 9
Nine.
is branches of the pulmonary vein,
Right.
most
Right.
anteriorly. Right pulmonary vein.
Yes.
Right pulmonary vein. Only in the right
Then
side.
then okay. What attaches to the diaphragm?
Lung to the diaphragm is pulmonary ligament.
What is the significance of pulmonary ligament?
Pulmonary ligament, it attaches the lung to the diaphragm. Also, it allows expansion of the lung to give space for the venous return in pulmonary hypertension.
In which part of peritoneum does proper hepatic loss?
Which part of the peritoneum does proper hepatic pass? The laser omentum, free edge of the laser omentum. Free edge of the
What
laser omentum.
crosses? What crosses in front and behind the xylem?
In front, phrenic nerve, and behind vagus.
Identify pathology in MRI.
Okay, this is section 22, meningioma. MRI. Identify the pathology in the MRI image. Parasagittal hyperdense mass like meningioma. This is parasagittal hyperdense mass which looks like meningioma.
What are three structures will the tumor affect once it grows?
Superior sagittal sinus, cerebral hemisphere, and motor area number 4.
What's the clinical picture of this patient?
Patient will have monoparesis of the contralateral lower limb. Monoparesis of the contralateral lower limb. Patient will have monoparesis of the contralateral lower limb.
Yes.
Monoparesis of the
Area of
contralateral
the
lower limb. Yes. Area number 4.
which layer of meninges is meningioma attached to?
Dura mater. Meningioma attached to
Yes.
dura mater.
Okay. Identify the following structures on MRI.
Okay. Can you tell me a little more? Pontine crystine. Which one here? Pontine crystine.
Pontine
Fontaine crystalline. You can see the picture. Fontaine crystalline. Sorry, Fontaine cistern. Prefontaine cistern. Prefontaine cistern. Is it above 5? That one arrow?
Orange.
Don't tell me color. Just tell me by number location. Supracellular cistern. Okay, you first tell me interpeduncular cistern.
Green.
Which one? Tell me with number relation. Near or below
Near
10?
10.
Below and left to 10. Because here color not coming properly in my screen. Is this one?
Yes. But I can see the color in the zoom. Blue 10. Blue 10,
This
that's
is interpeduncular cistern.
yeah. And the blue 8, there is another arrow.
This is
Pointing
prepontine.
to,
This is prepontine cystine.
yeah.
This is
And
not yellow. This is not yellow actually. It is showing
orange.
orange, yes.
Yes. Yes.
And
And
17
17,
is the
you
pituitary.
mean red arrow, supracellular.
This is
Supracellular.
pituitary gland.
Yes, but above it, supracellular cistern. Prepontine, before prepontine, that's prepontine cistern. So above pituitary, supracellular cistern, and in between midbrain, junction of midbrain, it's interplanetary cistern.
Okay, now let's see again. You can start from the first.
Corpus callosum.
Corpus callosum here. Corpus callosum is number 2, 6, and 18.
Cerebellum tonsil.
Cerebellar tonsil number 8.
Cerebellum.
Cerebellum number 9.
Cisterna magnum.
Cisterna magnum number 13.
First ventricle.
Fourth ventricle number 15.
Pituitary gland.
Pituitary gland number 17. Thymus number 19. Thalamus 19.
Sorry. Interplanetary cistern.
Interpeduncular cistern. This one is green arrow.
Yeah.
Interpeduncular cistern.
Prepontine cistern.
Prepontine cistern. This orange or yellow. This is prepontine cistern.
Supracellular cistern.
Supracellular cistern. Supracellular cistern is this one.
And the skull shows the course taken by sinus system, start
What is
from
what is
spread.
one? One not one is marked here, but nothing. Okay, it is not asked. Okay, next. Okay, in the skull, show the course taken by the sinus system starting from the superior sagittal sinus in the skull. Show the course taken by the sinus system starting from the superior sagittal sinus and name all the sinuses while you describe till reaching the internal jugular system vein. Okay, superior sagittal sinus, then drain into uh, confluence of vein, then transverse sinus, sigmoid sinus, internal jugular vein. Okay,
What is the major vein draining?
great cerebral
Draining
great cerebral vein of Galen.
okay. How does the red sinus reach internal jugular vein?
Okay, superior sagittal sinus joined with superior sagittal sinus joined with superior sagittal sinus joined with occipital sinus, and then they drain into confluence of sinus. From confluence of sinus, they drain into I don't. I will say from that our previous one.
Okay.
How was that? That was actually superior sagittal sinus drain into straight sinus, and then straight sinus drain into inferior cerebral vein. They join together and they drain into confluence of sinus. From confluence of sinus, they drain straight sinus, and straight sinus join with superior petrosal sinus, and then they drain into inferior, and then they become sigmoid sinus. And with sigmoid sinus, inferior petrosal sinus join to drain into internal jugular vein.
What is the position of the cavernous sinus on skull? Where?
Show the position of the cavernous sinus. Okay, it is the lateral side of the sella turcica.
What blood is received in neural venous sinus?
From superficial system and deep system. Superficial system, superior, medial and inferior cerebral vein, and deep system, medullary vein and great cerebral vein of Galen. Great, great vein of Galen. Superficial system, superior cerebral vein, middle cerebral vein, inferior cerebral vein, and deep system drain from medullary vein and great vein of Galen.
What's the structure with the black arrow?
Black arrow is epiglottis.
Yes. Show the bright occipital circuit.
Parieto and occipital sulcus. This is the parieto occipital sulcus.
Where?
This is parieto occipital sulcus. In between, this is parietal, and this is occipital.
Which neurological area is located in precentral layers.
Area number 4, motor area 4.
Primary motor cortex.
Primary motor cortex, yes.
Which part of the body represented in the medial side of the motor area?
Lower part, lower limb.
Medial side of the motor area. What's the difference between upper motor and lower motor? Facial velocity.
In upper motor neuron lesion, only lower half of the face of the opposite side will be paralyzed. But in lower motor neuron lesion, both upper and lower part of the face at the same side will be paralyzed. Because in upper motor neuron lesion, they have dual supply.
Other than circuit, what's the middle source of blood supply to the brain?
What is that?
Other than circle of voice, what's the major source of blood supply to the brain?
Vertebrovascular.
Yes. But in which answer there, middle cerebral artery.
Medial cerebral artery. Medial cerebral artery. Medial cerebral artery.
Describe the course of vertebral artery starting from outset of atlas.
In atlas, it crosses posteriorly and goes transversely. Then it okay. Sorry, Dr. My mouse not working. Now that
Describe of vertebral artery.
okay. Crosses transversely across the posterior arch of the atlas, then enter the skull through the foramen magnum. Inside the skull, the two vertebral arteries passes upward, forward, and medially in subarachnoid space to reach the anterior aspect of the medulla oblongata, then unite together at the lower end of the pons to form basilar artery. You can repeat.
They crosses transversely across the posterior arch of atlas, then enter the skull's foramen magnum, passing inside the skull to vertebral arteries pass upward, forward, and medially in the subarachnoid space to reach the anterior aspect of the medulla oblongata.
Other than circle of wheels, what is the major source of blood in the brain? Medial cerebral artery. I think this answer also okay because vertebrobasilar artery
is
part of the circle of wheels. Skull station 23. Nowadays this is a common station. In every center they are keeping skull picture. You have real skull. Whom you killed and kept it with you.
Mentions the middle cranial fossa, and that's anterior.
Okay, medial cranial fossa boundary, anteriorly lesser wing of the sphenoid and anterior clinoid process. Posteriorly, petrous part of the temporal bone and dorsum sella. Petrous part of the petrous part of the temporal bone and dorsum sella, and laterally squamous part of the temporal bone. Again, anteriorly lesser wing of the sphenoid and anterior clinoid process. Posteriorly, petrous part of the temporal bone and dorsum sella, and lateral side squamous part of the temporal bone.
In extradural hemorrhage, which vessel is or
Medial meningeal artery,
in subdural.
bridging veins and the cerebral veins.
How does ICP affect oculomotor nerve?
Increased ICP will cause herniation of the medial temporal lobe, and it will compress over the oculomotor nerve and against the petrous part of the temporal bone, and patient will have eye will go downwards and laterally, and ptosis and mydriasis.
Where is it compressed?
Against the petrous part of the temporal bone. Petrous part of the temporal bone, which is the posterior part, petrous part of the temporal bone. Posterior part of the temporal bone. Petrous part of the temporal bone is the posterior part of the temporal bone. Petrous part of the temporal bone is the posterior part of the medial cranial fossa. Exactly there will be compression. If there is medial temporal lobe, medial temporal lobe herniation, herniation of the medial temporal lobe.
Where it is compressed? Okay. Where does internal causal artery enter the skull?
Carotid canal. Internal artery enters the skull through the carotid canal.
High intracranial pressure sequence.
Mm, High intracranial patient will have morning headache, projectile vomiting, loss of consciousness, seizure, blurring of vision, papilloedema, and Cushing's tired. That is high BP, low heart rate, and irregular breathing.
Most motor nerve damage at the same time.
No, one after another.
Where is CSF?
In the ventricle of the brain, around the brain and the spinal cord in the subarachnoid space.
If a lesion arises from central gyrus, which part of the skull will be affected?
Central gyrus parietal bone.
What artery supply middle region?
This question, so many variation of answer. If you read one answer in one source, next time in next source there will be another. Next time will be another. So I'm also now, I don't know, but I will go with that concept. What artery supply the middle region of the brain? It is middle cerebral artery.
You can ask ChatGPT.
Yeah, can you ask? Can you ask, please? The
Yeah.
same question. Ask exactly. What artery supply the middle region of the brain? You are asking.
The middle cerebral artery is the lateral or middle region of the brain, including most of lateral surface of the frontal parietal temporal lobes. So, in contrast, the region of the brain is primarily split with anterior cerebral artery, which nurtures the median frontal and parietal lobes. As our previous
Again, can you?
middle form
I didn't understand. Middle portion of the.
is he means that the middle part is the lateral surface, of the frontal parietal temporal lobes. So the blood supply is middle cerebral artery, while medial region of the brain supplied by anterior cerebral artery, which nourishes the medial surfaces of frontal and parietal lobes.
Very good. So our concept is clear. Lobe is supplied by the medial cerebral artery, and medial is supplied by the anterior cerebral artery.
Yes. Where does the oculomotor
One,
nerve originate?
1 second. You can see the screen now.
I cannot see.
You can see now. Hmm. So parietal bone, and what artery supply the middle region of the bone? Middle region of the bone is supplied by medial cerebral artery. Where does the oculomotor nerve originate? From midbrain.
I cannot see screen.
Huh?
How does I cannot see screen? How does it come out of the skull?
I'm sharing the screen again. Can you see the screen now?
Yes. How does it come out of the skull?
Which one?
Yeah.
I mean oculomotor nerve. Oculomotor nerve through superior orbital fissure. Hmm. Oculomotor nerve, superior and inferior division of the.
What's the sign of compression due to high intracranial pressure?
Pupil mydriasis.
What's the muscle affected when ptosis happens?
Levator palpebral superioris.
The structure related to cylinder split?
Pituitary gland.
Good. Next. Vertebral artery course. Okay. Point to the posterior arch and the transverse foramen. Posterior arch.
Posterior arch is this one.
Which number?
Number 6 and 7.
Yes. And the transverse foramen?
8. This is posterior arch. Transverse foramen.
Yes.
This is transverse foramen. Transverse foramen. And
Number?
number 1
Eight.
is anterior. This is the front.
Yes.
This is front.
Yes. I asked about posterior arch.
And this is back or posterior. So posterior arch is point the posterior arch and the transverse posterior arch is number
6.
Number 6 and transverse foramen. Okay, this is posterior arch. Only 6. Posterior arch 6 and number 8 is transverse foramen.
What do the vertebral artery and basilar artery supply the brain?
Brainstem, cerebellum, spine, and occipital cortex. Okay, brainstem, cerebellum, brainstem, and spine together. Brainstem and spine, cerebellum, and occipital cortex. Brainstem, then spine, cerebellum, and occipital cortex.
What is the clinical picture of medial cranial artery?
Medial cranial artery hemiparesis of the lower half of the contralateral face, hemiparesis of the upper and lower limb, and aphasia in the dominant hemisphere. Again, you can repeat.
Yeah. Hemiplegia of the lower half of the contralateral face. Hemiplegia of lower limb, lower half, contralateral upper and lower extremities. Okay. Hemiplegia of the contralateral upper and lower extremities. If it is in dominant hemisphere, will cause aphasia. Hemiplegia of the lower half of the contralateral face and hemiplegia of the upper and lower extremities. If affected dominant hemisphere, will cause aphasia.
Identify in angiogram of internal carotid artery. Okay. Number 1 is anterior cerebral artery. Number 1.
15.
Number 1, anterior cerebral artery. Number 1, anterior cerebral artery. Okay, we can start from the down. 22 is internal carotid artery. Then it is giving first branch 31. It should be ophthalmic artery. Yes, ophthalmic artery. And opposite it, just going 39. It should be posterior cerebral artery. Okay, posterior communicating artery. Maybe 30 is the.
You remember? You remember when we saw the picture and saw that third line posterior communicating, and in answers of question was posterior cerebral artery. In images present, it's posterior communicating.
Okay, let's see. Then 39 will make as posterior communicating artery, right? Okay, so 31 going anteriorly, it is ophthalmic artery. 39 posteriorly, posterior communicating artery. Then number 1 anterior cerebral artery. Number 30 is medial cerebral artery. What else? We have 15. 15 is frontopolar artery. This is also new. Frontopolar artery. Frontopolar artery. Frontopolar artery. 15 frontopolar artery. 34 pericallosal artery. These are the new. So I think these are the checklist answer. We can follow this answer.
Which?
These answers.
Okay, frontopolar artery.
Frontopolar artery 15 and 34 is pericallosal artery. Pericallosal artery. Pericallosal artery. Again, 22 internal carotid artery giving first branch, 31 ophthalmic artery, then 39 posterior communicating artery, and number 1 anterior cerebral artery, 30 medial cerebral artery, then number 15 frontopolar in the frontal lobe, and in the terminal end, that's why polar, frontopolar artery, and 34 pericallosal artery. Okay, you can repeat.
One anterior cerebral artery.
Hmm.
15 frontopolar artery. 22 internal artery. 30 medial artery. 31 ophthalmic artery.
34
very
pericallosal. 34 pericallosal artery. Pericallosal artery 30 medial cerebral artery, 39 posterior communicating artery, 15 frontopolar artery. First branch of the internal carotid artery after entering the skull, ophthalmic artery. Hello.
Yeah.
Okay.
What is the physiology of this cerebral angiogram?
In the cerebral angiogram, there is an aneurysm. Aneurysm of the
Where?
anterior cerebral artery. Aneurysm of the anterior cerebral artery. This is anterior cerebral artery. Middle cerebral artery.
Anterior,
Hmm?
anterior cerebral along with internal carotid.
Hmm. It is actually lateral view. That's why we are seeing like this. We are branching, going from the lateral side. What? Okay.
Have if it's ruptured,
Subarachnoid hemorrhage.
tube of branches of middle cerebral artery.
Middle, middle, middle cerebral artery. Middle cerebral artery. Central branches. Cortical branches. This is new question. Name of the branches of the medial cerebral artery. This is medial cerebral artery. We have central branches like lateral stria or lenticulostrate artery. These are the central branches. Central branches lenticulostriate lenticulostriate artery and cortical branches. Central branches l- later, lateral stride and cortical branches. Cortical branches are anterior temporal artery, lateral frontobasilar artery, frontal artery, artery of the precentral sulcus, artery of the central sulcus, artery of the postcentral sulcus, parietal branches, angular artery, medial temporal branches. Oh, middle cerebral artery, we learned it in different way, right? We learned it like uh, pre-parietal, prefrontal, prefrontal, precentral, central, postcentral, auricular, and posterior parietal or posterior temporal. This one will get it from our note. Okay. How does internal carotid artery enter the skull? Internal carotid artery entered the skull. Are you sleeping?
No,
Yes.
no, not sleeping, but not active.
Why?
I don't know. I am trying to
Stand up. Don't
awake.
don't sit. Stand up and read. Stand up.
Stand up.
Yes. Read in standing position.
I'm not able to see laptop well.
Don't sleep.
Hmm?
Don't sleep. You can stand up. You can stand up and can turn your laptop little like this, and then you can continue. I'm also feeling little drowsy, but no way, no option. Okay. So, internal carotid artery enters the skull through the carotid canal in the petrous part of the temporal bone. Internal carotid artery enters the skull through the carotid canal. Internal carotid artery enters the skull through the carotid canal in the petrous part of the temporal bone and runs above the foramen lacerum and then gives its branches. Runs above the foramen lacerum, then it gives its branches. Okay. Okay. Then next.
Above.
Run above the foramen lacerum. Internal carotid artery enter the skull through the carotid foramen. Then it runs above the foramen lacerum, and then it gives its branches.
Okay. Identify second, third, six cranial nerves.
Second means optic. Optic will be in up. This is optic chiasma, optic nerve. Then this is pituitary gland. Then this is cavernous sinus. Cavernous sinus, medial wall, lateral wall. In the medial wall, we have internal carotid artery with abducens nerve, and the lateral wall, serially from above down, we have uh,
Okay.
we have oculomotor, oculomotor, and then trochlear, and ophthalmic and maxillary. Oculomotor, OT, OM, OTOM. Oculomotor, trochlear, then ophthalmic and maxillary. Maxillary will be uh, the lower.
Yes.
Okay. So identify second, third, and sixth cranial nerve. Second is optic will be above, and third oculomotor will be just next to carotid artery, oculomotor, and trochlear also, and ophthalmic and maxillary. Maxillary will be down. And see the sinus structure. Sinus structure. This is diaphragm sella, pituitary gland, internal carotid artery, cavernous sinus, and dura and sphenoidal sinus. Sphenoidal sinus, then nasopharynx. Okay. Okay. Then
Identify superior orbital fissure.
superior orbital fissure. Superior orbital fissure. Superior orbital fissure. It is number. Superior orbital fissure number 42.
Foramen spinulosa.
Foramen spinosum number 14.
Foramen oval.
Foramen ovale number 12.
Foramen rotunda.
Foramen rotundum number 13.
Okay. Optic canal.
Optic canal number 34.
Flavus.
Flavus 4.
Is foramen oval. Contents.
Foramen ovale, otic ganglion, mandibular division of the trigeminal nerve, accessory artery, lesser petrosal nerve, and emissary vein.
Foramen spinosa.
Foramen spinosum, uh, maxillary artery. No, no. Foramen spinosum is medial meningeal artery and meningeal branch of the mandibular nerve.
Rotunda.
Rotundum maxillary nerve, maxillary artery,
Nerve.
nerve.
Optic canal.
Optic canal, optic canal, optic canal, optic nerve, and ophthalmic artery, and some emissary, uh, optic canal, optic nerve, and ophthalmic artery,
And
and some emissary vein and sympathetic my mouse not working. I don't know. And
Why?
I'm not able to move. Wait, I'm using my hand. Okay, foramen ovale, otic ganglion, B3, mandibular division of the trigeminal nerve, accessory meningeal artery, laser petrosal nerve, and emissary vein. Foramen spinosum. হচ্ছে middle meningeal artery and middle meningeal artery and meningeal branch of the mandibular nerve. Middle meningeal artery and meningeal branch of the mandibular nerve. Foramen rotundum. Foramen rotundum maxillary nerve. Then foramen rotundum maxillary nerve. Optic canal, optic nerve. Okay, optic nerve and three layers of the dura. Optic nerve, three layers of the dura. Ophthalmic artery. It is an end artery. Again, optic nerve, ophthalmic artery, and sympathetic nerve. Optic nerve is the main nerve with three layers of the dura. Also, we have sympathetic nerve, and ophthalmic artery. Then superior orbital fissure, superior orbital fissure, superior orbital fissure, superior orbital fissure,
Yes.
superior and inferior division of the oculomotor nerve. Then uh, superior and inferior division of the ophthalmic uh, vein, and then trochlear nerve, frontal, lacrimal, nasociliary branch of the uh, ophthalmic division of the trigeminal nerve. This answer was very easy for me when I was reading from previous one, but when I came to know this FLN means frontal, lacrimal, and nasociliary branch of ophthalmic, and then remaining was all the same superior and inferior division of the uh, oculomotor, trochlear, and abducens. Anyway, lacrimal branch of the ophthalmic, no, uh, sup, um,
View and view ophthalmic vein.
superior and inferior ophthalmic vein, superior and inferior division of the oculomotor nerve, then frontal, lacrimal, and necessarily division of the ophthalmic division of the trigeminal nerve, and yeah, these are again superior and inferior ophthalmic vein, superior and inferior uh, oculomotor nerve, then frontal, lacrimal, and nasociliary division of the ophthalmic division of the trigeminal nerve. Lacrimal branches of the ophthalmic vein, frontal branch of the, okay, it is done, and cleavus abducens nerve. This picture, okay, superior orbital fissure 42, foramen spinosum 14, foramen ovale 12, foramen rotundum 13, optic canal 30, optic canal 34, plevus 4, and what is number 30? Number 30, where is 30? This is 30. This is jugular foramen. Number 30 is jugular foramen, content anteriorly, inferior petrosal sinus, posteriorly, sigmoid sinus, which joint with inferior petrosal sinus to form internal jugular vein, and intermediate glossopharyngeal, vagus, and accessory nerve. I wish they asked me this one in the exam. I like this one.
Which
This one,
which
jugular foramen.
can you identify carotid canal in this skull?
Carotid canal. Yes, this one.
Which number?
There is, I think, number 10. Let's finish this one, then we will read in details about this skull from our PDF.
We finished. Plevus abducens nerve.
Reverse conditions. Okay, so it, it didn't take much time.
Yes.
Now,
And it's
now
nice revision.
it's a
Nice revision. But we will return to your bed.
you like that one?
Yeah.
Okay, thank you. I feel honored.
Yeah.
I feel honored, really, that my 1 year's work at least
Yeah.
um, helping.
What's the origin of lesser petrosal nerve?
Laser petrosal nerve.
Yes. Mm. Here, it's written from contents of foramen ovale. Otic ganglia, okay,
Yes.
mandibular.
Laser petrosal nerve.
Lesser.
OVAL. L for laser petrosal nerve. That is,
What
but
act and where is origin? What
origin
any
no
information
need.
about it?
Why you want to know laser petrosal nerve?
To know from where it comes to where.
I was in your situation when I started, and if you see my PDF file, you can
I
see.
think if you as we search for middle and medial, we will never forget it. And there is some similar structures. You can not happy with them. Lesser great ocular. Lesser petrosal, lesser petrosal. Lesser petrosal nerve. Lesser petrosal nerve parasympathetic branch that drives from glossopharyngeal nerve. Its fibers originate in the inferior salivary nucleus of the medulla oblongata. These preganglionic parasympathetic fibers travel with glossopharyngeal nerve, branch off as tympanic nerve, also known as Jacobson nerve, and form the